Welcome to the Open Circle, brought to you by the Leprosy Mission Trust India and supported by the Rotary Club Delhi South. As you know, the Open Circle is an inclusive space where we engage in issues and around very, very meaningful conversations around health, well-being, disability, and inclusion. And today we are talking about a very, very interesting topic that's very close to all of us, and that is mental health. And we are very, very excited to bring to you a very eminent psychiatrist, Dr. Mohit Varshney, with us, Associate Professor, Department of Psychiatry, Institute of Liver and Biliary Sciences. Dr. Mohit, as I'd like to call him, completed his MD in Psychiatry and DM in Addiction Psychiatry from AIIMS, New Delhi. So to begin with, thank you so much for coming. And I'd like to ask you to demystify mental health a little bit, because there are so many complexities around understanding what mental health is. So if you could demystify mental health for us.
Sure. So first of all, thank you so much for your generous introduction and the compliment. And most important, thank you for having this conversation with me. I mean, I should be the one thanking you for talking about this mental health conversations. ये सब बातें we do mostly in lectures, panel discussions, conferences, and I've always been saying that the real work is not done in hospitals, in conferences. The real work is done at the ground. And with TLM's mission and the way you people operate, I think this should go along with this conversation. And coming on to let's start with what mental health is, right? So what is mental health? The general perception people have is that it is the absence of a mental illness. See, we have always been raised in a dichotomous world, where either you are a topper or you are nothing, right? Unfortunately, that has also trickled in our health-related conversations. Either you are healthy, you are unhealthy. There's no in between. And that is what causes so much trouble for doctors, for psychiatrists, for everyone. Because there is a notion that mental illness hai, then you have a problem with mental health. Otherwise, you are mentally healthy. So no one talks about the journey from health to illness. And that probably is where this conversation can actually go a long way. If we talk about science, World Health Organization describes mental health is a place where a person can feel, can provide for his family and society, and deal with normal stresses of life. So do you see the last line here? That deal with normal stresses of life. So dealing with normal stresses of life is where mental health is health. And when it becomes dysfunctional on a day-to-day basis, it can become mental illness. And this is one thing I want our audience to know, that it is not something out of the world. It is as simple, as basic as going to a gym. So there is no either you are bodybuilder or normal. There's a lot of in between there.
So we tend to put a lot of focus on our physical health rather than mental health. What do you think about it?
That is excellent, actually. Something that I talk about every day in the clinics. For most of us, mental health remains invisible till our body starts showing the signs. On an everyday basis, you will not believe the number of patients that come with deranged body functions, with deranged some heartbeat issues, palpitations, on and off gastric issues. Indian population has a lot of gastric issues. It's a published scientific fact. So people, because they have been going through unusual amount of stress throughout, that's why the body starts showing signs of stress. That's when they get all the things done. And then at the end of that, they reach a mental health specialist or a psychologist or psychiatrist. That journey is a separate topic. Maybe we'll talk about it during the podcast, that from knowing that you do not have a medical condition to reaching a expert, that journey probably will require another full podcast in itself. So yeah, so the issue is that we only recognize once it's start affecting our body. And to continue this discussion about emotional distress versus mental illness, that's also an important aspect. See, we have discussed so far health to distress, we also need to discuss the other side, right? From
Right.
distress to illness. So there are some red flags, something that we need to know which differentiates human distress, that me, you, everyone around us feels when something goes wrong in the day, to mental illnesses. The major red flags are two. Again, two. Very simple to understand, very simple to remember. One is the duration, the second is dysfunction. Distress तो है, but अगर distress lasts for a particular duration, and that your counselors, your psychologists, your psychiatrists tell better, it is generally 2 weeks is the standard criteria, that if it lasts beyond a particular time, then it is something which is illness. The second red flag is dysfunction. Now, dysfunction can both be emotional as well as economical or productive in your day-to-day world. So you can simply be dysfunctional in a way that you stay in your room, do not interact with anyone, do not eat your meals properly, just stay glued to your screens and not do something which generally helps to declutter the brain. So dysfunction and duration are the two Ds for differentiating distress from illness.
For somebody who is suffering very silently, what are the signs that they should watch out for, which could be perhaps mental illness, and where should they go and whom should they reach out to?
So you're asking where to draw a line.
Yeah.
That is exactly what I'm saying. You don't need probably to start with drawing a line. What people should understand are the early signs. Like something that our society understands well, वहाँ से start करते हैं. Heart attack हमारी society अच्छे से समझती है. उसकी prevention हम कहाँ से start करते हैं? Like checking your BP every day, blood pressure check करने से start करते हैं. कभी हार्ट में, चेस्ट में कुछ प्रॉब्लम है तो एक सिंपल ECG कराना है. ये हर इंसान knows very well, right? बट जहाँ मेंटल हेल्थ की बात आती है, हमें लगता है दिस इज सम बबल, हम उसको पुश करते रहेंगे टिल इट बर्स्ट्स. सो मेंटल हेल्थ इज लाइक एनी अदर फिजिकल हेल्थ. द साइंस आर वेरी वेरी स्लो, एंड इट इज़ नॉट लाइक देर इज स्लो इरोजन बिफोर इट रीचेज अ ब्रेकिंग पॉइंट. So if you are asking about early signs, person being irritable most of the times, not having the energy, feeling helplessness. In fact, if you'll, in field workers who talk and who screen around the world, they have actually found out two questions that can really work. Like simple question that how is your sleep? How are you sleeping these days? And how have you recently felt hopeless? Just very two simple question. You can train all workers. These signs, if you can teach to people who actually do the work, go to the field and do, even then early things can be picked up. Of course, there is a wide variety of scales, questionnaires. People can be trained in actually identifying, screening them. But let's understand we are talking about a country of more than 140, 150 crore people. There will always be shortage of people who are actually screening, and there will always be plethora of people who are struggling or people on the other side. So that is something that just asking two questions, if you can implement, the early signs can be felt. If we want to go deeper, early signs, as I said, could be fatigue without any reason, irritability without reasons, changes in mood, appetite, sleep, or excessive use of substances to cope with your emotional feelings. So these are things that can literally be identified early and can be implemented for routine field work. And this is not just something that I am saying. This is based on WHO, even our own NIMHANS, Bangalore, on their studies where they have gone to the health, have trained the rural workers in identifying, and they found that the accessibility in people's understanding about accessing mental health treatment significantly increased. So that is something we should do.
So the two questions you're talking about are, how's your sleep? So it can be both excessive sleep or lack of sleep, or is it both?
Good question. Yes, it can be both. It is not that, again, we cannot see mental health from a dichotomous point of view, right? It is not that if you're sleeping normal, then you're perfectly fine. If you're sleeping less, you're perfectly abnormal, right? It could be a mixture of things. To each its own is the thing. And that is where, after the screening is done, the role of a professional, a role of a psychologist or a psychiatrist will come. We'll talk about that later. But importantly, dichotomy से हटाना है. I mean, it is not important कि ज़्यादा sleep can also be a sign of mental illness. कम sleep can also be a sign of mental illness. Normal sleep can also be a sign of mental illness, because it is not the quantity that is important. Because in this number crazy generation we are in, most social media posts talk about 6 hours of sleep, 7 hours of sleep, 8 hours of sleep, and everything else is fine. So we have to stop seeing things in isolation. I mean, when we talk about screening in a field level, it's different from an individual person, right? Just like all screening programs, screening is based on what can be done easily, or what is doable, right? In an individual person, all three can happen. They can have less sleep, normal sleep, as well as bad sleep, while still struggling with mental illness.
So I have a very interesting question, because I see the generation today, the lifestyle is very, very different. Some people sleep at 3 o'clock in the morning, 4 o'clock. There's that work from home also, hybrid working conditions. So there are times when children are sleeping at 3 o'clock, waking up early to go to school. And I see, and lifestyle, the food. Does food, lifestyle, sleeping also affect mental health?
Right. So food, lifestyle, and sleep, the current lifestyle. एक तो ना current lifestyle में brain in itself has gotten very confused. You see, for time immemorial, we lived according to the sun, right? The sun rises, people get up, do their activities, the sun sets, they come back home, and then they spend the rest of the time in either spending with family or sleep. Right now, one, with the advent of this light, second, with the advent of internet, we are 24/7 connected. And unfortunately, what it does to our mental health is it makes the brain forget that what is a relaxation time and what is a active time. Because the brain is always kind of active, even when you're scrolling through your Instagram feed or your any social media feed, your brain is active. So it forgets how to relax. You ask any kid, any adolescent in their young ages, they will not know how to relax. They will not know how to sit idle for a minute. They'll have to do something, because unfortunately brain has lost the capacity to it. With add on to that, we live in a capitalistic world, let's be honest about it. So productivity is everything. So somehow it has been taught to us that even if you're productive by working 16, 18 hours a day, you're fine. Because again, humans are dispensable in this country. आप 16-18 घंटे काम करोगे 5-10 साल में, you will reach a point of burnout. It's okay, there's someone else who will take your place. So we are talking about a society that values productivity over human life, over human longevity. And that in itself says volume कि भाई हमें तो तुमसे जितना काम निकल सकता है उतना हम निकाल लेंगे, उसके बाद someone else will take your place. So ये conversation बहुत deep है कि ये lifestyle, I mean जो current lifestyle है, how it impacts mental health and how can it be prevented. But one message that हम अपने audience को दे सकते हैं in this question is that धीरे धीरे अगर 15 मिनट 20 मिनट twice a day start rewiring your brain. आप उसको relax करना सिखाओ. बहुत सारे लोग डीप ब्रीदिंग एक्सरसाइजेस बताएंगे, जर्नलिंग बताएंगे, बट स्टार्ट सिटिंग आइडल करना अगर स्टार्ट करेंगे, स्टार्ट विद 5 मिनट्स. ओके, इफ यू डोंट हैव 5 मिनट्स, स्टार्ट विद 1 मिनट. Even that will help in the long run and gradually increase. As they always say that 0.1% extra every day will make a huge difference over a year or a 2-year period. So 0.1% idle time in your day is what I'm asking. That can go a long way in teaching your brain how to stay idle. And by staying idle, your brain can learn how to relax. That is something which is causing bulk of the problems right now.
So that is very interesting, because yes, some people say the coping mechanism when you're really stressed is do deep breathing, do journaling. But this is a very interesting point that you're making, being idle for 15 minutes. Ideally, even in my case, whenever I get 1 minute, I'm busy scrolling on the phone. And when I'm scrolling on Instagram, I get more stressed because I see everybody either holidaying or very, very successful, becoming entrepreneurs, earning 1 million, and that is a big, big stress for me. In this case, I also feel that social media is also creating a lot of awareness on mental health.
Correct.
But there's a lot of stigma around mental health. Even if a person recognizes they are having some form of issues that they need to reach out to the doctor, when is the best time to reach out to a doctor and whom to go to?
When to seek for help, as I told you, the two D's. When distress starts becoming dysfunctional, that is where you see when you seek help. But where to seek help is still a problem that I think both our government, the private sector, everyone is trying to solve. And as of now, we do not have a clear-cut solution of when to seek help. That is the exact reason why the focus is more on prevention. That is why the focus is more on early identification, school mental health programs. That is where the government is actually doing meaningful work, although it's still very less. It's a drop in the ocean, but still a lot of work is being done in early identification, teaching people basic skills how to deal with stress. Okay, now I have a question for you. This is where I generally start my discussions in schools, with children, with parents. What is your understanding of the word mediocre?
Mediocre is somebody who doesn't really excel in life and who's okay being, okay, I mean, just generally, na idhar ke na udhar ke.
Well done. I am glad that you give a very natural answer. That is exactly what people feel. मैंने अभी अपने सुबह सुबह अपने पेरेंट्स से भी ये क्वेश्चन पूछा that mediocre का क्या मतलब है? They said who's just average. बात तो सही है. Average is mediocre. Mediocre का simple translation is average. But ये जो just लग गया और जो आपने बोला excel नहीं कर पाया, that added a lot of tonality to it. That added a lot of condescend to it. That made it, it makes you see like a failure that because you couldn't excel, that's why you're mediocre. We also have to realize that human beings are in a bell curve, right? There will be some who will be laggards, there will be some who will be leads, but majority, 95% will be in between. That is the bell-shaped curve rule.
Right.
So why from such early ages, why do we promote excellence at the cost of being average? मैं बोल रहा हूँ आप excellence की तारीफ करो, हमें अपनी generation को, बच्चों को average बना के रोकना नहीं है, but हमें average feel कराना की ज़रूरत नहीं है. Because one person who's average can still be made to feel good about how they are. अगर आप constantly उनको यही बोलते रहेंगे that ना excellent नहीं हो आप. So the value laden judgment जो हम add कर देते हैं mediocre में, this is the bottom line of majority of children's, even adults, even people of my age. In fact, I'm just saying this with me also. This is a problem with me also, right? That people, हमें लगता है कि अगर हमने excel नहीं किया तो this is, I feel this started with this whole cinema thing. अभी तो हम social media को वो करते हैं. The cinema started portraying heroes as heroes and others as just sidekicks. So that is where it got so imbibed in our psyche that या तो आप hero हो, number one हो, या फिर आप कुछ नहीं. And वहीं से सारे struggles शुरू होते हैं. Because you see, there is a rule of probability also. When you are born, you're born with a genetic material, your environment, all this will make you reach somewhere. Someone who's born with a little more better environment, a little more with better genes, will probably go a little far. So सबकी अपनी अपनी individual journey है ना. उन journeys को एक दूसरे से compare करना is the biggest cause of mental health struggle. And this is what now Instagram is doing. We are easily blaming Instagram, but go to 90s, 80s movies. They were doing it. Right. Everyone was doing it. Everyone wants to talk about the 1, 2, 3. And believe me, I have met so many people in the last 15 years of my practice that there is hardly any difference between 1 and 10. 1 and 50 even. In a large cohort if we take, there's hardly any difference. But why do we only celebrate 1, 2, 3? Right? That is where the root of stigma, हमारी problem start होती है stigma की with the word average और mediocre. अगर हम एवरेज से वैल्यू लेडननेस जो है हमारी उसको स्कूल लेवल पे हटाना शुरू करें, दैट एवरी चाइल्ड शुड बी सेलिब्रेटेड, लाइक एवरीवन हैज सम क्वालिटीज दैट इज डिफरेंट फ्रॉम अदर्स, तो उसको सेलिब्रेट करते हैं ना. आप उनको एक्सीलेंस के लिए बोलते रहो, आई एम नॉट सेइंग मत बोलो, बट सो दैट इज वेयर द स्टिग्मा कम्स इन. अब जो बंदा एक्चुअल स्ट्रगल कर रहा है मेंटल इलनेस से, जो इंसान एक्चुअल स्ट्रगल कर रहा है मेंटल इलनेस से, उसको सबसे पहला जजमेंट का फियर ये है दैट यू नो आई विल बी जज्ड. आई सिट इन द क्लिनिक, पीपल कम एंड सिट विद मी एंड सी व्हाट्स हैपनिंग. आई एम अ डॉक्टर जिसकी चीज़ के लिए आप आए हो मेरे पास, एंड स्टिल यू हैव वरीड दैट आई विल जज यू. उनकी गलती नहीं है, दे हैव बीन जज्ड इन अ लॉट ऑफ clinics, that's a separate thing. But if someone is being judged, if someone is fearing being judged inside a mental health cubicle, imagine how they're feeling in the world. So this root of stigma starts from this core thing that we teach in our childhood to our children कि भैया या तो excel करो या तो तुम कुछ नहीं हो. So, and that is what, and it is not just social, you know, I'm just telling you social aspects of stigma. There is a biological aspect. So what it does is it teaches the brain. So brain की wiring होती है बचपन में, right? Wiring is a crude term I'm using. So brain की जो wiring होती है, उस wiring में the child learns to see himself that way. So in every social situation they'll go, जब भी जाएंगे उन्हें यही लगेगा कि यार मैं excellent तो नहीं हूँ, मैं अपने मन की बात कैसे कहूँ, I'll be judged. This is a major problem, and that's the reason people seek help at a time when it's very late. It has already caused a lot of damage to themselves, their health, their physical health starts getting affected, and that is the alarm bell rings, and then they reach to professionals.
So there's a lot of stigma around mental health and even doctors. Just the fact of going to a psychiatrist, if you tell somebody to go to a psychiatrist, if they are having some form of anxiety or you notice some depression, the first response is, मैं पागल दिखता हूँ.
Exactly.
So, you know, we don't really understand how helpful it would be to take some kind of medical help, but there is awareness, and also because at the Leprosy Mission we work with people affected by leprosy. Leprosy is the leading cause of disabilities globally among the communicable diseases, while depression is the leading cause of disabilities among the non-communicable. So the moment a person is diagnosed with leprosy, they fear so much because of the negative perceptions. There's so much of stigma around the disease,
Right.
that they really either stop taking treatment or don't come back to us for treatment. And we've seen a lot of people who are even admitted in hospital facing a lot of self-stigma.
Right.
Facing stigma from the community. There is so much discrimination happening. What can we as the Leprosy Mission in our hospitals do to, like you said, work on prevention? What can we do in the early stages to prevent that stigma and from people having mental health issues?
So simple conversation से start कर सकते हैं. Someone who's struggling, उससे अगर हम पूछें या फिर तुम परेशान हो, अब क्यों परेशान हो? You know, and I am not making this up. This is the usual conversation that happens. Someone who walks into the hospital or a field work going, अब तुम क्यों परेशान हो? तुम्हें खाना मिल रहा है, छत मिल रही है. You are getting roof, things that previous generations had to work hard for it. You have it all. Why are you upset? So this tone is a problem, right? अब जो लोग आज की ज़माने में जी रहे हैं, उनकी problems आज की होंगी. You can't expect them to go back to 90s and model their brains for lack of food, oxygen or shelter or those type of things. You can't expect their brains to be modeled that way. Then in such cases, what can we do? In such cases, what can we do is we can train people to ask open-ended question, not judgment. How did you cope last week? Simple thing, not value-laden, not judgment-laden, just simple. That आपका पिछला हफ्ता कैसा रहा? ने कैसा अपनी प्रॉब्लम से, अपने स्ट्रेस से कोप करने में कुछ प्रॉब्लम हुई क्या, बस सिंपल. अगर है तो ठीक है, नहीं है तो भी ठीक है. एटलीस्ट कॉन्वर्सेशन विच इज़ द थीम ऑफ टुडेज पॉडकास्ट ऑल्सो, एटलीस्ट वहाँ से तो स्टार्ट करें. वो बातें करना तो स्टार्ट करें कि इनिशियल पार्ट से. ऊपर कहाँ जाएंगे वो तो बहुत लंबी कहानी है, बट एटलीस्ट स्टार्ट एट द बेस, remove judgment from our day-to-day questions. And this is what you can train your field staff, that do not start with a question that you expect yes no answer to. Start with open-ended questioning. Let people express. एक चीज़ और, I remember the very interesting thing. So couple of days back I was talking to someone that Indians ना जब बात कर रहे होते हैं, हमारी कुछ देयर समथिंग विद द ब्रेन्स वायरिंग दैट वी आर थिंकिंग अबाउट हम क्या बोलेंगे नेक्स्ट. सो पेशेंट लिसनिंग इज समथिंग, इज अ वर्च्यू दैट इज नेवर टॉट. जस्ट लाइक एज आई सेड कि बीइंग आइडल इज समथिंग इज नॉट टॉट, पेशेंट लिसनिंग है ही नहीं. सो वन थिंग दैट यू कैन ट्रेन देम इज टू बी जज ओपन माइंडेड, not ask judgment laden questions. Second is just patient listening, and this anyone can do. Their peers, the leprosy peers, people who are working in the field, the healthcare workers, people in the hospital, they can simply listen and not think of the next answer they'll have to give. And that goes a long way in not only breaking the stigma, in making the other person feel heard. And once they feel heard, then the story becomes easier. In the first interaction, if they feel they're heard, second interaction, they'll be more expressive. Third, fourth interaction, then it becomes a cakewalk for you to understand people dealing with mental health issues.
So thank you. That's a very, very important tip that we've got from you about patient listening. And we're trying to develop a network of peer counselors who can go into the field, who can meet people affected by leprosy and other disabilities, even the communities. So how can families play a role in getting them out of depression or anxiety? What is the role that a family or a community play?
So as usual, throughout this podcast, I'll again start with an anecdote. So I met a patient who is going through a chronic physical disability, and he told, I can deal with the illness, but I find it hard to deal with how people make me feel about the illness. You know, there are two aspects to having something like some disease like leprosy or any other chronic debilitating illness. कि पहले तो उस इंसान को डिजीज से भी डील करना है ना, फिर आपसे डील करना है जो आप जज कर रहे हो अबाउट देयर लुक्स, अबाउट हाउ दे वॉक, हाउ दे टॉक. सो दैट पार्ट पीपल फाइंड इट वेरी वेरी हार्ड. एंड इसमें ना द फर्स्ट स्टेप इज इन फैमिलीज, बिकॉज दैट इज एग्जैक्टली हाउ देयर फैमिलीज आर ऑल्सो ट्रीटिंग देम. द फैमिलीज डू नॉट पेशेंटली लिसन. वो उनकी बात को, दे डू नॉट अकाउंट फॉर हाउ दे आर फीलिंग इन कॉन्वर्सेशन. फैमिलीज उनके साथ बैठ के खाना खाना, बैठ जाना, just having normal conversations without having a phone or a device in your hand, those things do not happen in family. So isolation, the root cause of mental health problems in people with chronic disabilities like leprosy, starts in the family. तो अगर आप उस isolation को break करने के लिए effort कर सकते हैं, it has to start in the family. It can start in the family for sure.
In your view, what is that one collective step we can take to build a better, mentally healthier India?
Okay. This is a question I'll answer at the cost of sounding preachy. I mean, just treat mental health as another vital sign. The way you treat body temperature, fever ke liye, the way you treat pulse for your heart condition, the way you treat BP, the way you treat your BMI these days, height and weight association, the way you treat physical health, start treating mental health as one of the 5 vital signs. That can actually go a long way in not only destigmatizing, also picking up things early. More importantly, health workers that go in the field will start seeing is that pulse लेने में कोई stigma feel नहीं करता ना. आपकी कोई आके pulse check करेगा, thermometer लगाएगा, because it has been so normalized. If you go back 100 years, there would be some people who would not be happy with getting their blood pressure measured or their blood sugar getting measured. Even in my community, at times there are people who do not believe diabetes is an illness, and where the evidence and science is different, but the thought is the problem. That when you talk about it, it should not give that feeling of either healthy or illness. It should become a part of your day-to-day life, right? And once it becomes a part of your day-to-day life, it can actually go a long way. And I'm not just saying it as preachy. There are economic aspects to it. There are studies World Health Organization has done which say that every 1 rupee invested in health and mental health related things gives back 4 rupees in lost productivity, in terms of efficiency, and in terms of economic value that a person can add in terms of health conditions that they suffer, so the health burden. So there is also an economic aspect to it. It's not just an emotional view. For people with leprosy, for people with chronic l- conditions, they suffer from the fact that they are judged by their condition. And you working in the field would know that even when they are leprosy, so-called leprosy champions, they're still leprosy champions. Start calling them champions, right? Why do we have to say people champions when they win an archery medal? Start calling people with leprosy as champions, so that they do not see their self-worth from their disease. And this is exactly the
Right.
stigma one has to break. It is good that despite that illness, you've done something in life. But if you're trying to tell someone that you're great, that person with leprosy will always feel that, it is because of leprosy I'm a champion. So again, आपने negative से हटा के, negative connotation of leprosy से हटा के positive introduce कर दिया. What you have not done is जो वो इंसान की self awareness थी, जो self vision था about himself, that has not changed. So that will always remain linked to that physical disability. So if we can separate and treat it as just like any other vital sign, this can go a long way at a country level, at a policy level, even at a field level, at an individual level.
Thank you. For somebody who recognizes they have depression or anxiety, is there any kind of coping mechanism or something that they can do themselves? Do they really have to go to a doctor?
Yeah, that's a very good question. As I said, that our ratio of doctors and mental health professional is very off, except in metro cities where the ratio is skewed to the other side. It's very off. It's very, very, very poor. So in that case, the self-work has to start early. As we discussed, the early signs of emotional struggle, early signs of emotional distress, then you can start implementing some steps, right? And I say that you can start with basic things like understanding your own happiness, your joy, setting boundaries in day-to-day work, simple things like journaling, doing breathing exercises. And I cannot overemphasize the role of exercise in a good mental health. And in people again see it as exercise से बिल्कुल ठीक है, बिना exercise के बिल्कुल गलत है. It is not dichotomous again. But with exercise, a lot of mental health struggles can actually get better with simple things like cognitive behavior therapy, where they don't need to go to a doctor to get medications. They can simply go to a counselor or psychologist, talk about their problems, and then maybe find ways to heal with it. As I said, just simple journaling at the end of the day. आप लिख नहीं पा रहे हो, put an audio note in your phone that this is what I felt good about the day. That also gives a lot of reflection. Being idle 15 minutes twice a day, doing physical exercise, celebrating small achievements, joys of life, limiting boundaries that, okay, this is where I will stop. बाकी काम मैं कल करूँगा. This can go a long way in helping people with mental illnesses.
That's a brilliant piece of advice. I have in the last 3 years bought 3 journals and I've never been able to even open one. And they're very nice visual ones, but I haven't started writing. But sending a voice note to yourself, a voice note on your phone is a very good idea.
See, the whole idea is rewire brain. It can happen through any medium. Writing is a medium that gives the maximum impressions on the brain. That's why all mental health professionals advocate writing, which is fair. That is how the concept of journaling began. And it is biologically proven that journaling helps you rewire the way you look at yourself. That's fact. But then if you're not able to make time for it, you have to start the habit. Start with a simple audio note, maybe 3 months, 4 months, 6 months down the line, when your brain starts looking forward for that journaling 15-20 minute session of yours, then maybe you'll be able to open that beautiful journal that you have purchased, right? The starting is the whole point.
So in this conversation, we've spoken about a lot of things, but I have not heard from you about the power of music or the role of music in helping a person. Because from my own personal experiences, whenever I'm feeling anxious or I'm unhappy or I'm sad, I put on I put on music, turn on the volume, and I'm happily dancing or working, and I forget my sorrows or unhappiness in no time. So what, according to you, does music play?
Fabulous. I mean, whatever gives one joy, that could be music, that could be dance, that could be exercise, that could be a sport, it could be art. Art is one of the most calming, satisfying exercises one can have. And the world is full with things like mandala art or simple. Just pick up a brush, start drawing something. That helps in reducing the anxiety. Music, dance, that also, all you're doing is you're trying to debunk your natural process, the natural anxiety triggers constantly going in your brain, and try into something that brings joy, right? इसमें मैं हमेशा एग्जाम्पल कहता हूँ, क्योंकि हम सबको बोलते हैं ना, यार तुम टेंशन मत लो. तो दिस इज द एग्जाम्पल आई गिव एवरी डे. टेंशन मत लो. आप आँख बंद, यू क्लोज योर आइज एंड डू नॉट थिंक अबाउट, क्लोज योर आइज, डू नॉट थिंक अबाउट अ ब्राउन मंकी वेयरिंग अ रेड जैकेट. क्या आया सबसे पहले?
Brown monkey wearing a red.
So just like that, when you give advice to people कि भाई परेशान मत हो, that is what they'll think. So the conversation should change to focusing on things that bring joy, rather than putting down your negative thoughts. Your negative thoughts are there for a reason, and they'll not go away by you trying to suppress them. They'll just come back later with more blow. So then that becomes a problem. Just start with celebrating joy. Just take a pause, take a moment, and do what you like. As you said, in your case, music and dance helps you. It can be different thing to everyone.
Great. So just one last and final question. There are many, many people affected by leprosy, many people with disabilities who are watching this podcast. And what is the final message that you'd like to give to them, people who are suffering silently and not being able to come forth? So what is the message that you'd like to send
Before
across
the message,
to them?
I want to apologize to them. I am sorry. Unfortunately, you're not born in a kinder nation. I wish they were born in a nation which was a little kinder. So that is one message which I want, at least you, people who are actually suffering from this disabilities, please start seeing yourself as humans, not some machines of the society, right? You're not what you're adding to the society. You're not what you're being productive. You are what you are. Start accepting yourself first. Once you start accepting yourself first, everything else gradually will fall in place.
So thank you so much, Dr. Mohit, for coming over here and talking to us. It was absolutely a wonderful time that we had. You demystified a lot on mental health, and I'd really like to thank you so much.
Great, you're welcome. And I don't know, I can continue this conversation for hours, and maybe we continue speaking about it, because there's a lot to be done. And this is, again, as I said, this is a drop in the ocean. Whatever little we can do. Thank you.
Thank you.
You're welcome.
So if today's conversation resonated with you, do share this conversation, like and subscribe to the TLM Open Circle, where we have conversations around inclusive spaces, health and disability. And until next time, do take care of yourself, and remember one thing, that mental health matters to each one of us. Goodbye.